Yes, indeed. This is Professor David Steinberg of the SteinbergFiles.com talking to you today about how under Obamacare there is a high probability that you will not be able to keep your current health insurance. Let's begin with a statement made by the President himself, President Barack Obama, in the piece Why We Need Health Care Reform, which he published in where else? The New York Times stated, and I quote, "If you like your health care plan, you can keep your health care plan." Let me repeat that. President Obama, if you like your health care plan, you can keep your health care plan. Oh, really, Mr. President? Well, you're a lawyer. Why don't we look at the evidence? This is a survey of 1,300 employers that was conducted by Business Journal McKinsey Quarterly. Of course, the mainstream media largely ignored this story because they only publish what's approved by the Obama administration. However, you will find it in CNS News, and you can find the survey, a link to the survey results in CNS News on the SteinbergFiles.com. What did the survey find of 1,300 employers? Overall, 30% of employers will definitely or probably stop offering employer-sponsored insurance in the years after 2014. It gets even better, hold on. In fact, among companies who are most familiar with the laws, Obamacare's mandates and regulations, 60%, that's 6 in 10, would drop employee health plans because of the law. Again, 6 in 10 employers said they would drop employee health plans because of the law. Among employers with a high awareness of reform, this proportion is more than 50%, and upward of 60% will pursue some alternative to traditional employer-sponsored insurance. But Mr. Obama, you said if you like your health care plan, you can keep your health care plan. What was that all about? Well, there's really only two possibilities that I can say. One possibility is that the president really just didn't know what the law was going to be all about. He was really clueless. It's a possibility, and I can't completely reject it, but if that's the case, that Mr. Obama should have apologized for this misstatement, saying, I didn't understand what was going on. He's never done that. So the more plausible explanation is that this was intentionally deceptive. In other words, President Obama was lying. Now, why would President Obama and the Democrats want this? Why would the government want employers to drop health care and stop sponsoring employee health care and paying for it? This has been one of the greatest virtues of our system, is that our employers have so generously provided and paid for employee health care. Why would you want employers to stop doing this? The answer is not that complicated. The answer is power. The Democratic Party and the Obama administration lust for power. They want power. They want control over you. And once you are forced to buy your health care from the government, they will have control over you. And they will have control over who gets health care and who does not. They will have the power to ration health care. That's what they want. They want the power of life and death. One other point I need to make about this survey published in CNS News and from the McKinsey Quarterly. If anything, it understates the number of employers who are going to drop coverage. Let me explain why. Let's say you did a survey of people, men and women, who were married, and the question was, have you committed adultery on your husband or wife? That's whatever results you're going to get are probably going to understate the true figure, because some husbands and wives are going to be honest and admit they had adultery, but that's a hard thing to admit. So some people, of course, are going to be dishonest, are going to deny having had an affair, having had sex outside the marriage, when in fact they have. Same with employers dropping employee health care. That doesn't sound very good, does it? Yeah, the minute we get it, we're going to dump all our employees' health care. So there's an incentive here, an incentive to say we're going to continue providing health care for employees when that's not really the case. So, if anything, these numbers that are tossed about in the survey, 30%, 50%, 60% or more, are too low. The bottom line, if you have employee-sponsored health insurance, if you get your health care from your employer right now, there's a high probability that if Obamacare takes effect, you will lose your coverage. That's what the facts tell us, not what the president tells us, unfortunately. This is Professor David Steinberg.